So normally, I open our workshop with a summary about the planned agenda, number of abstracts, and registration, but I think we really need to acknowledge that this is not a normal time. So in the space of 1 year since our last meeting, political upheaval, particularly in the United States, has decimated global investment in critical HIV and health programs and threatens the incredible progress that we had been making in eliminating new pediatric HIV infection and making healthy and long lives a reality for children living with HIV. So the question is anybody going to talk about the elephant in the room? So here are some of the elephants in this room. It's very sad. So this is from an article in The Lancet by Lucy Cover and her colleagues that modeled the impact of the PEPFAR funding freezes on children, particularly African children. And you can see projected HIV infections on the left and projected AIDS deaths in children on the right. And in just 5 years, by 2030, without PEPFAR, it's estimated we'll have 1 million more child HIV infections and 460,000 more child deaths caused by AIDS. All of this preventable. So what are we actually seeing? So CHI just put out an HIV impact memo and covered some of the things that are actually happening as opposed to projected. So first, there is a drop in pediatric case finding and antiretroviral start in 4 of 5 countries that were surveyed between Q4 2024 and Q1 2025. So a decrease in just 4 months of US government policy changes. We see rising rates of pediatric loss to follow-up in 4 of 5 countries between Q4 2024 and Q1 2025, with one of the countries now having 42% loss to follow-up. We see decreasing or stagnant numbers of children starting treatment in every country that was surveyed, as shown on the chart. And decreased new PrEP starts in 7 countries, with 140,000 missed new starts between these 2 quarters. And PEPFAR has stopped any orders for oral PrEP. The good news is that PrEP for pregnant and breastfeeding women is still allowed, but this leaves non-pregnant women and adolescent girls out of the picture. But we are a resilient and innovative group committed to reaching our pediatric HIV goals, and we have overcome barriers before. So what can we do? So the first thing is we can build a resistance to the US assaults on public health. And the pictures show some of the rallies that have occurred in the United States just in the last few months. And the other 2 pictures show ACT UP. Silence equals death. Remember, ACT UP did work, so we need to ACT UP. We need to have folks work with your governments and evaluate and innovate. And in just the last few months, there's been a number of important policy brochures that have been put out. There was a meeting in February of leaders from 11 African countries to develop policy recommendations with a policy recommendations book. Just last month, the WHO put out a booklet on sustaining HIV services, priority services in the changing funding landscape that talked about how one might prioritize programs for funding. So would recommend everyone take a look at these. We need to be brave. Women and girls need to stay at the center of the HIV response. This is from an editorial that was in Lancet just a few days ago. They said cuts to HIV funding must not mean that the first cut goes to HIV services for women and girls and to policies that promote gender equality and equity. And to draw on the bravery of the history of the HIV/AIDS response, hold the line. Any HIV response without women and gender at its center will be a failed HIV response. So this is another Lancet paper that was, I thought, pretty good, talking about the global HIV response and what one might do. And they talked about strengthening integrated health service delivery, which we have already started, streamlining delivery methods, harnessing technology, targeted investment in services for key populations, support the whole of society engagement, strengthen donor coordination and accountability, and to leverage greater domestic resources. So in short, what can we do? Work with your government to prioritize domestic funding and national ownership of HIV programs, which was already happening. We just need to speed that up. Prioritize external funding and resources for research and innovation. Reimagine partnerships with pharmaceutical and public sector. Amplify the voice and needs of communities, and hopefully use this meeting and other interactions with colleagues for creative thinking and brainstorming. We can still do this. And now back to the workshop and the usual stuff.